Hello and welcome to everyone who's with us today. This is the fourth installment of the Lungs on Fire speaker series for 2025. I'd like to welcome you all here. I'm calling in from Vancouver General Hospital, which is the unceded territory of the Musqueam, Squamish, and Tsleil-Waututh people. We're happy to be here, happy to have you with us. For those of you who don't know, the Lungs on Fire project is a 5-year CIHR-funded project that's focused on better understanding the harms of wildfire smoke and thinking about how we can improve public health guidance in this context. We've had a number of speakers in this series, and today I'm just delighted to welcome Cathy Slavik. Cathy Slavik is the incoming Simon Fraser and Legacy for Airway Health Chair in Health Communication. Her expertise is in developing and testing health education tools that are aimed at increasing public awareness of environmental health risks. And that includes wildfire smoke, which is, of course, our focus for today. She has a background in understanding how to motivate health protective behaviors. Her PhD is in health and geography from McMaster University, and she also has a master's of public health in environmental and occupational health from the University of Toronto. And I believe your postdoc was from University of Oregon. Is that right, Cathy?
That is
Um,
correct.
so we're really happy to have you with us here today. And of course, we're extremely excited that you're going to be joining the Legacy team starting in January. And we're grateful that you were willing to speak to us even before your start date. So for those of you who haven't attended one of these speaker series before, we have a format where, the speaker talks for about 45 minutes, 45 minutes to an hour, depending on how much they have to say. And then we have a structured sort of discussion and we invite questions from the audience. So we'll get to that shortly. And before we start, anything you'd like to say, Cathy, before I hand it over to you? I guess that's a
Happy
silly
to
question to ask. You're like, well,
happy
I'm
to
going to say
start,
the things that I'm going to say.
unless there's
Okay,
any other housekeeping.
no, no housekeeping. Okay, thanks so much for being with us, Cathy, and over to you.
Sure. Well, thanks, Stephanie, and thanks again to Lungs on Fire for the invitation. I guess I'll start off by saying I'm currently in Toronto for another 4 or so days before I move to Vancouver. But so that does mean that I am currently on the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples. Toronto is, of course, now home to many diverse First Nations, Inuit, and Métis people, and it's a privilege to call this place my home. Now, I have spent many years studying health communications, most recently actually at Health Canada. That's where I've been for a little over a year now, mostly studying how to leverage health communications to advance smoking cessation. But before this, I spent a couple of years living in Oregon. I was at the Center for Science Communication Research over there. And I did my Banting postdoctoral fellowship researching radon risk communication. That was until about 1 month into my postdoc in Oregon, where I got to experience my first big wildfire smoke event. And to say that it had a massive impact on me is a bit of an understatement. Not only because I have asthma, and so I got to experience my first wildfire-attributed asthma exacerbation, which is something I really had only read about in journal articles up until that point. But also because I saw how communications were kind of falling short in many ways. As I spent hours researching what the smoke was doing to my health and what I could do to try to minimize my own exposure, it started to really dawn on me that I probably wasn't the only one struggling to make sense of the information available out there. And so improving wildfire smoke communications has definitely become a bit of a personal crusade. I'll be the first to admit there. So, what's wrong with how we've been communicating about wildfire smoke? You'll notice the title of this talk certainly pointed to us needing to improve it. But why does it need improving? Well, for one, as a West Coast newbie, I was hearing from a lot of locals in Oregon one of two things. Either that I didn't need to worry so much about the smoke and that wildfires have always just been a part of life there on the West Coast. But others said quite the opposite. They said that the smoke seasons had become way worse than anything they remembered growing up with, and that kind of also stuck with me. Those folks turn out to be right. We know that the risk of being exposed to wildfire smoke is changing, especially across North America, with smoke events becoming more frequent. longer and more intense. We also know that as smoke reaches communities further and further from the source of the fires, that populations that never before experienced this kind of smoke are suddenly contending with exposure every summer, and many lack the awareness and the necessary preparations to kind of respond to this. This changing risk landscape is also a reversal of previous improvements to air quality that we had made in North America. Certainly, growing up in Ontario, we thought that our smog days were over once coal-fired power plants closed here more than 10 years ago now. And so people's risk perceptions around air pollution haven't exactly kept up. They haven't necessarily adapted to this new normal, and people still kind of believe that air pollution is improved. We don't need to worry about that anymore. So I started to wonder, are communications meeting some of these new challenges amid this changing risk landscape? First, I do want to start by establishing what even constitutes effective communications if we're interested in this idea of improving them. So the WHO uses a strategic communications framework that has five main pillars of effective communication. These include timeliness, accessibility, credibility, and whether or not the communication is understandable and actionable. So are wildfire smoke communications timely? I myself was really interested in this question when I arrived in Oregon. And so one of the first studies I set out to explore was researching public health department social media communications in the Pacific Northwest in the US, specifically to take a look at how frequently health officials were tweeting about smoke and how that actually matched up against daily air quality index values, which are an indication of wildfire smoke in the air. And so what I saw was that communicators were taking a more reactive approach. Certainly, you can see that on the graph here, that tweets spiked when the AQI spiked. So is this bad? Maybe not inherently, but it does suggest that communicators were doing very little proactive communication during smoke off seasons. And this is time when people could perhaps use reminders to make preparations like swap out old filters in their air purifiers for new ones, for example. What about accessibility? Well, fortunately, smoke communications are disseminated via multiple channels and formats across various languages. For example, this alertable app shares wildfire smoke advisories in many different languages. And while it's great that there are growing options to access information, apps and websites like this are really only as effective as their uptake. And different resources often have different advice, which can be a little bit confusing for the average user to navigate. Are communications credible? Well, sources of health news are highly fragmented by age group, with some sources and communicators being perceived as much more credible and trustworthy than others. And unfortunately, according to a large-scale survey that was conducted last year by Abacus Data and the Canadian Medical Association, about 1 in 5 Canadians do not fully trust health news stories about the health effects of wildfires and poor air quality. In other words, nearly a fifth of Canadians may not believe that wildfire smoke poses a true threat to health and may not be protecting themselves and their families from wildfire smoke when it's present in the air. So clearly, there may be some work to be done here to try to increase trust and perceptions of credibility. Are communications understandable? Let's take a look at a common type of wildfire smoke communication, the Air Quality Health Index. In this particular graphic, it's telling us a number of things, such as the fact that the level is at a 4 out of about 10.5 or 10 plus. This corresponds to a moderate risk. And so this is telling us that if you're part of an at-risk population or the general population, you either should consider modifying your behavior outdoors or that there's no need to do that. But take a moment and think about what information is missing from a graphic like this. What is missing that could help someone make a more informed decision about what kind of action to take? I encourage you to just take a quick pause and think about that. Here are certainly some things that I think are missing. Who is at risk? What constitutes strenuous? What can I do if I have to be outside? And what's so bad about wildfire smoke anyway? Coughing and throat irritation doesn't necessarily sound all that bad. These are a lot of the common kind of questions and comments that I get from friends and family anytime I encourage them to take a look at the Air Quality Health Index. What about the visual itself? Is the presentation of the AQHI easy for people to understand? How does it compare to something like the US's AQI, which often takes this sort of shape, the graphic on the left? As a Canadian living in the US for a couple of years, I actually wondered about that. And so I decided to run an online experiment with thousands of parents who lived on the west coast of Canada and the US. And I randomly assigned them to view air quality infographics that either contained the US AQI or the Canadian AQHI to see how they would stack up against each other. Now, based on our experiment, parents who saw the AQHI did seem to understand that even a moderate air quality reading could be risky to health. They reported higher levels of concern on average compared to the parents who viewed the AQI. When the infographics indicated a high level of wildfire smoke in the air, there wasn't actually much difference between the two groups. So, at least fortunately, it seems like we did choose the right scale and visual to communicate air quality with here in Canada. Are communications actionable? So, in that previous experiment I described, we also studied whether air quality infographics influence parents' willingness to take certain actions reducing exposure to smoke. And we saw that participants randomly assigned to view the AQHI also reported higher action intentions. So that's optimistic, right? But how frequently are AQHIs checked anyway? We also asked that question to the parents in our survey. And among the parents in British Columbia, about a third of them, so 172 out of 500, reported checking the AQHI daily during wildfire smoke seasons. At the same time, nearly a quarter reported that they never checked it. So perhaps we could try to bump up those numbers a little bit. What does the picture look like across the rest of Canada? A survey by Nanos this past summer asked people across Canada whether they changed plans due to wildfire smoke or purchased an air purifier due to smoke. And although uptake was pretty decent across the prairies in British Columbia, uptake elsewhere was pretty low, despite the fact that Eastern Canada had more smoke days last summer due to the way that the wind transported the smoke out east. So, why this low uptake? Are a lack of communications to blame? I hope that by the end of this presentation, you'll agree that effective communications could, in the very least, help us address some of these gaps in action. And that's because effective communications have been shown to increase awareness about wildfire smoke and motivate protective actions. But often what's missing is a clearly defined communication goal that's guiding the message. Communications are a health intervention, and when they're effective, they can be a powerful tool for reducing exposures to hazards like wildfire smoke. But like any health intervention, they do require development, experimental testing, smart implementation, and continuous evaluation. Finally, communications are also important because they present an opportunity to address misconceptions, generate trust, and encourage public participation and dialogue. But for that to happen, trusted messengers do need to be identified and actively partnered with. So let's go down this first point and really break down how we choose a communication goal for wildfire smoke communications. There are two really common communication goals in public health and certainly in the world of wildfire smoke. The first is raising awareness about the health risks, and the second is motivating protective actions. People often assume that awareness leads to action, following a very kind of linear model. But in reality, people make decisions and do things all the time without full knowledge. So that's not always the case. These are two very different goals, and they do require different communications. And I'll show you why with a very quick lesson from the cognitive sciences. So information processing starts here at the bottom with information. Let's say we're talking about something like a fact sheet on wildfire smoke. Now, as we read the information in the fact sheet, our eyes start to perceive the words and the images, and our brain tries to make sense of this. On first glance, our attention usually zeroes in on particular elements that get stored in our short-term memory or working memory. Think about things like bolded words or colorful graphs on our fact sheet. From there, we might store the salient information from the fact sheet, like those bolded words, in our long-term memory, where we store this learned information in order to use for future decisions and take future actions. Alternatively, that fact sheet might actually motivate us to take a more immediate action and respond on the spot. Or we might simply read the fact sheet and move on if it's not a particularly effective one and forget that we ever read it. But something else can also happen. Let's say that that fact sheet contained a very emotive image, something like a child struggling to breathe. Well, then we might process the information in the fact sheet rather differently, using a mental shortcut that quickly overrides that previous process. This shortcut is called an affect heuristic, and we leverage our emotions or feelings in this kind of heuristic. So think about emotions like fear or outrage or even joy. And we use this to make a very quick judgment about the information presented that informs a decision or an action. Now, I get it. We've been told for a long time that making decisions based off of our feelings is irrational. It's primitive. It makes for ill-informed decisions. But might I remind you that this kind of processing based on emotions and vibes worked for humans for a very long time, in fact, for thousands of years. And so it is a really efficient way to make a quick decision in the face of danger. A lot of research also does suggest that information that triggers the affect heuristic tends to be remembered longer. And this suggests that it both can motivate immediate action and also be stored for long-term memory and knowledge. So, in other words, information can make you think in a very deliberative way, or it can make you feel something. So, systematic information processing requires more higher cognitive load. It's more effortful, and this can result in a very analytical decision making that takes time. On the other hand, heuristic information processing relies on mental shortcuts, like the affect heuristic. So, why might we want information to help us do one or the other? Well, systematic information processing is often associated with the promotion of long-term awareness about health risks of smoke exposure, for example. It can also shift attitudes and counter misinformation. It can also increase resilience by teaching people how to make preparations for smoke season. How do we make communications engaging enough to encourage people to carefully and thoughtfully process the information in it? We might want to use tailored communications to maximize relevance and draw people in, like this fact sheet that I've shown here on the slide for workers. We also probably want to use simple messaging and visuals that will be really easy for people to remember and store for future use. When something looks too complicated, people actually tend to skim it and rely on the heuristic processing. So, another way that we could encourage this kind of more slow and deliberative information processing is by using cues that encourage a reader to pause and think, like asking them a question, such as, can you name 5 things you can do today to protect your family from wildfire smoke? Why might we want to encourage that emotional, gut feeling heuristic information processing? Because it enables quick decisions, as I mentioned, by reducing mental effort. It can promote action adoption during emergencies like smoke events, and it can assist audiences with more limited health literacy using simple cues. So, how might we enable it? Well, we can use emotional imagery. Think back to our fact sheet with the child who has asthma, or we can use vivid colors like this infographic to really try to grab people's attention. So, simple visuals and infographics that leverage familiar cues quickly convey meaning and also speed up that kind of information processing. And messaging that highlights the urgency and the severity of the situation can also heighten perceptions of risk and trigger quick judgments to inform a decision. Now, raising people's perceptions of risk is tricky, and it shouldn't necessarily be the sole goal of a health communication tool. Why not? Well, because it tends to trigger two maladaptive responses, that is, behavioral responses that are unhelpful or even harmful to health. The first one is panic. Of course, when people's perceptions of risk are high, they tend to panic and be really clouded over in this kind of fear mentality. The second is avoidance or disengagement, like this jogger who's going for a run when the AQHI is at a 13. So, scaring people can't be the only goal here. Even if it can be a strong motivator of behavior change in some instances, we don't want to avoid on relying on it alone. So, how can we balance out risk perceptions with other kinds of messages? Fortunately, there is a useful framework that we can draw from called protection motivation theory. The theory posits that people's intentions to protect themselves from harm are influenced by four cognitions. The first is perceived severity of health consequences associated with the risk. The second is the likelihood of experiencing harm from that risk. And together, these cognitions help someone appraise the threat from that risk, like wildfire smoke. Then there's the perceived effectiveness of mitigative measures to protect yourself from that risk. This is something we call response efficacy. And there's also the belief known as self-efficacy that one can successfully execute the measures, the protective actions. And so these two cognitions form the coping appraisal. Now, although this particular infographic from the previous slide might activate heuristic information processing and help someone understand that they are under threat, it might not actually be very effective at inspiring behavior change because it's missing a lot of that information that could help someone with the coping appraisal part, right? It's not telling us what is an effective action to take given a certain circumstance. It's not necessarily encouraging someone that these actions are easy to take and that they're capable of taking them. The model is a great starting point for thinking about communications and behaviors, and it can tell us a lot about the sorts of things we should be thinking about including in our smoke messages. These are things like details about the health consequences of smoke, details about the hazard, as well as the magnitude of the threat, so how severe or how harmful is the smoke. It also includes information that helps a reader understand the probability of encountering the threat of smoke and whether or not they are susceptible to experiencing harm from smoke. It also suggests that it would be beneficial to add details about the effectiveness of various protective actions to help people make an informed decision, maybe presenting a good, better, best kind of air purifier scenario that someone can use to decide what might be the best option for them. And lastly, messaging that emphasizes the ease of implementing such actions while addressing perceived barriers like financial costs or others. Now, the PMT focuses on the individual's response, and it does kind of ignore the bigger context surrounding people, which we know can also shape beliefs and attitudes about the threat and how we might want to cope with that threat. These include things like social cues from friends, family, neighbors. It also includes things like environmental cues, such as sights, smells, and sounds, which are especially important for environmental health risks like wildfire smoke. So now that we have a strong theoretical background in this stuff, let's see what the scientific evidence tells us about what works well for wildfire smoke communications. We'll start with messaging. What can we do here? Fortunately, this is probably the best researched area of wildfire smoke communications, and the literature points to air quality advisories and alerts being effective, but only if people know where to check for advice and if they already believe that poor air quality is harmful to their health. Highlighting which protective actions are most effective and why also seems to be a very effective kind of messaging, which we know is consistent with that protection motivation theory framework, along with describing how an action might be easily adopted in order to increase self-efficacy. In an effort to provide tailored, relevant information to readers, we often see advice presented for both at-risk groups and general population groups. And although it's great to continue to include both, evidence also suggests that it's perhaps even more important to highlight that even healthy individuals can experience symptoms from and health impacts from wildfire smoke exposure. In Health Canada's fact sheet that they produced last year, they actually did a pretty good job of including this kind of messaging that I think is a great example. So they wrote, during heavy smoke conditions, everyone is at risk, regardless of their age or health. Some people are more likely to experience symptoms or health effects when exposed to wildfire smoke. So we saw the do's. Let's cover the don'ts. First, the evidence is pretty clear that we should not skip information about health effects when talking to people about wildfire smoke because they aren't obvious to everyone. But once you know about them, you start to worry a little bit more about them and think about them and want to protect yourself. Highlighting protective actions like relocation and visiting a clean air shelter may not actually be all that helpful. These actions tend to be the least likely to be adopted, and so they're better placed towards the bottom of a list. People seem to find these kinds of actions to be impractical, and it could actually lead to a zero risk bias, where if somebody believes that an action isn't the most effective, then it's not really worth doing anything at all. There is also evidence to suggest that we shouldn't shy away from using narrative messages or stories about how community members are responding to wildfire smoke in order to promote engagement. When it comes to visual risk communication, what are the do's and don'ts? So first, when presenting the AQHI, it does seem to be helpful to show the full line graphic rather than just a number, and this helps to increase risk comprehension. This might be due to people's mental number line, which is a phenomenon where people have an easier time contextualizing the value of a number when it's placed on a simple scale, visually speaking. Visual icons have also been shown to help with information recall. And one study suggests that simple maps can also be effective communication tools to highlight areas affected by smoke and help people make sense of forecasted changes in smoke. But a lot more experimental work is definitely needed here. This is kind of a gap in the literature. For the don'ts, negative imagery does not seem to promote engagement or behavior change. And as I discussed earlier in this talk, relying solely on that kind of emotive information often tends to just raise perceptions of risk without kind of inspiring that action. It's also not particularly beneficial to rely on one single visual format. So communication campaigns that use multiple types of media are needed for dissemination channels and platforms to reach lots of different kinds of audiences. On a bit of a side note, although there hasn't been too much research testing visual communication strategies in the wildfire smoke domain specifically, there have been tons of experimental studies testing visuals for other purposes in public and environmental health more broadly. And visual risk communication is one of those areas that I'm actually most interested in exploring because there's just still so much we don't really understand in terms of specific mechanisms that trigger things like memory or attention and emotion, which we know are critical factors influencing how we process visual information. So if anyone else is interested in this kind of stuff, let's definitely team up and do some cool work. Now, another growing area of research is numeric risk communication and how to communicate numbers more effectively. As a general rule of thumb, it's good to use numbers, and most readers do want to see them in communications. But oftentimes, health communicators have this false belief that numbers do more harm than good, and really, it's more of an issue of making sure you're using them properly. So, communicating numbers in familiar formats that people are used to interacting with, for example, reduces cognitive load and does increase risk comprehension. Helping people make sense of numbers by contextualizing them or including comparisons is also beneficial. In this particular infographic, they've compared the US AQI to the numbers of cigarettes smoked in a day. And that's a really great way to kind of make sense to abstract numbers to people. The risk communication literature also shows some pretty consistent studies that most people prefer risk information that contains numbers in addition to verbal descriptors of risk. And this is because they trust the numbers more and do find it more helpful and useful to make decisions. Now, environmental cues are also really strong motivators of protective behaviors because of the way humans tend to respond to sensory experiences. But unfortunately, by the time you can see or smell wildfire smoke, some people will already have experienced health effects. So it's important to remind people that smoke is dangerous even when it's invisible. Or as Health Canada puts it, there is no known safe level of exposure for some of these pollutants. This means that smoke can impact your health even at very low levels. Now, if you remember earlier on in this talk, I mentioned how folks in Oregon either acknowledged the changing risk of wildfire smoke exposure or kind of minimized it, claiming that smoke has always been around. And it's important that misconceptions like that are debunked by communicating about how and why the risk has actually grown and shifted. So for the don't, it's also important we don't neglect communications highlighting social norms around smoke preparedness. It's been shown that this kind of messaging can motivate action through a kind of fear of missing out. It signals to people that attending a community DIY box fan event is something they want to feel like they're a part of, something that they should be participating in because everyone else is doing it. Now, one of the most common questions health communicators get, especially post-COVID, is how to best communicate uncertain information. And although the literature specifically for wildfire smoke uncertainty communication is a bit sparse, we do know that communication, what we know about the effectiveness of protective actions, is important. This can motivate action through that response efficacy cognition that we saw in the PMT. And I think this CDC infographic is a great example of that. It uses this kind of good, better, best approach to show people that they have options and any option is better than none. What we've learned post-COVID is that acknowledging we're learning more about the risks to health is a good strategy for normalizing uncertainty and helping people feel comfortable with evolving guidance rather than viewing it with pure skepticism. And as a rule of thumb, we generally want to avoid applying overly technical or complex language to describe risks. And certainly we want to avoid conflicting advice across agencies and communicators. So I know I've thrown a lot of information at you about what seems to work and what doesn't work, but a crucial piece of the communication puzzle is also figuring out who should be communicating, not just what they should communicate. And so one obvious partner is health professionals, like family doctors, as doctors are consistently ranked as some of the top sources of health information, and many vulnerable populations do rely on them pretty extensively for health advice. But a lot of health professionals are not wildfire smoke experts, and they might not always feel very confident discussing risks with their patients. So, how can we try to engage them on these issues? One strategy is to co-create communication materials, which strengthens engagement with the knowledge broker, in this case, doctors. And that's actually why I partnered with a pediatrician from Emory University named Dr. Rebecca Phillips-Bourne to co-create a few easy communication strategies that doctors could try with their patients and their families to educate them about wildfire smoke. So it's never a bad idea to work with these kinds of partners directly. The Western States Pediatric Environmental Health Specialty Unit is also a great group that has a lot of really cool resources about wildfire smoke communications. So if anyone's interested in this kind of work, then I would encourage you to visit their website and take a look at their stuff. Another important partner for communicating wildfire smoke is schools and educators, especially given children's susceptibility to health effects from smoke exposure. So, school initiatives have popped up in many communities on the West Coast for data co-creation using air monitors in classrooms to track wildfire smoke exposure and actually engage teachers and parents about the importance of checking air quality and monitoring data. I was really fortunate to work on a cool project spearheaded by researchers at Oregon State University and the city of Ashland in Oregon to track levels of fine particulate matter in classrooms in the city of Ashland. And importantly, work like this allows us to engage with school administrators and teachers and talk to them about air quality and wildfire smoke preparedness so that they can in turn share this information with the parents at these schools and try to increase parents' checking of resources like purple air to track what kind of air quality is happening in their schools. Experiential learning interventions like summer camps are also a really promising way to teach students about wildfire smoke risks. And as I was kind of leaving Oregon, there were some really cool pilot studies happening at Oregon State with summer camps. Finally, community organizations remain an underutilized partner for wildfire smoke communications. Whether it's local fire departments, faith-based organizations, library staff members, amplifying the voices of trusted and well-respected community members is crucial for lasting behavior change. And it's also just a great way of meeting people where they're at and wherever they're at. This is why I was really excited when Dr. Anne-Marie Nickel at SFU asked if I wanted to help her research team facilitate some workshops last year, teaching vulnerable populations like seniors on how to build their own low-cost DIY box fans. And it was a really cool experience teaching this group some hands-on skills to build a simple piece of equipment and at the same time educate them about the importance of checking air quality communications, whether it's on the news or on websites, and how to use these filters when the air quality index indicated that the air was not safe. So that's all great, and we've covered a lot of ground, but is there anything else we're missing here? I didn't really have time to cover this angle in today's talk, but it is worth acknowledging that the medium for communications have shifted, and there are newer ways of communicating that are continuously popping up, but many remain untested in terms of their actual measured impact on outcomes like knowledge or behavior change. Nonetheless, platforms like TikTok have been shown to be pretty effective, especially for public education and disaster risk communication, because they offer real-time risk messaging, kind of an on-the-ground look of what's happening. Going forward, I think it'll be really interesting to also see how virtual and immersive technologies like VR headsets, for example, could be used to offer experiential learning opportunities and measuring real-time behavior change without actually exposing people to harmful levels of wildfire smoke. I also focused my talk today on wildfire smoke broadly, but communication about other forms of smoke, whether it's wood smoke in the winter or prescribed fires or cultural burning, does kind of complicate the science of health communication. And that's because we want to simultaneously educate people about the dangers of smoke exposure while increasing support and tolerance for some kinds of smoke. So, this kind of dual messaging is notoriously difficult to communicate because we don't want to communicate the benefits of some fire and some smoke to overshadow the perceptions of harm from wildfire smoke more broadly. Some really interesting initial literature in this space does seem to point to early and transparent and culturally relevant communications to be especially important, but I think a lot more research is kind of needed to explore this area. So, hopefully, by now, you've reached the end of the talk, and you can walk away with 6 communication tips to keep in mind going forward. The first is choosing which communication goal you're trying to tackle and choosing one goal at a time. Is it awareness? Is it action? Because you simply can't construct a coherent, effective message if you're trying to do it all. Once the goal is set, deciding whether that goal would be better met by encouraging systematic or heuristic information processing is also a really important next step. And then it's a matter of choosing the type of message and the visual cues that enable that kind of information processing. It's also really important to remember to communicate the why and the how, not just the what of wildfire smoke. So people want to know why they're being asked to do something and how it's actually going to help them, how it's it going to benefit their health. Next, we've seen the importance of leveraging trusted communicators to help you reach a wide audience. But last but not least, knowing your audience is really kind of a crucial piece of this puzzle. Communications are a big responsibility and they should be approached with care because we're communicating to help people and we need to keep them in mind and then keep in mind that these are real people taking real decisions. At best, ineffective communications may lead the public to just think that a communicator is incompetent. But at worst, we might actually be inadvertently moving someone towards a more harmful decision, one that they wouldn't have otherwise taken, or it might lead to distrust down the line. So testing communications with the target audience is really kind of a key thing to do here. And that leads us to the end. I'm glad we have lots of time for questions and discussion. A big thank you to all of you for your attention and curiosity in this topic. Hopefully we can have a good, solid discussion around it.
Okay, thank you so much, Cathy. Um, we've often left the recording on for our discussion session, but I'm actually going to stop it today because we have moved away from putting the whole discussion online. And I think if I turn it off, possibly we'll get a little bit more engagement from folks. So, barring any strong objections, I'm going to go ahead and press stop on the recording.